Hello, everyone. Good afternoon. It is so good to be here on a Thursday, and welcome to the Creative Care webinar series. It is wonderful to see people joining us from across many different communities and sectors today. Please find a comfortable position, go ahead and have your lunch, tea, coffee, and tune in to this conversation. My name is Christen Kong, and I'm a health promoter at Access Alliance Multicultural Health and Community Services, where I really focus on advancing newcomer mental health and wellness through the arts. One of my favorite parts of this role is supporting capacity building, like doing things like webinars and mobilizing knowledge in ways that we can really meaningfully shape everyday practice and community care. So today I'm very excited to host our second Creative Care webinar. It is part of a 6-part series to advance arts integration in healthcare and settlement. This series is funded by the Public Health Agency of Canada, part of the Hubs of Expressive Arts for Life HEAL project. And I have the pleasure today of moderating this session. So before we start, I would also like to acknowledge the land in which many of us gather on here today. Those of us from Toronto are on the traditional territories and lands of the Huron-Wendat, the Anishinaabe, Haudenosaunee, and the Mississaugas of the Credit. We are an organization that serves immigrants and refugees that face systemic barriers, and we recognize the ongoing impacts of colonialism on Indigenous, Métis, and Inuit people. And we are honored, and we want to honor the resilience and resistance of Indigenous communities across Turtle Island. So I want to also reflect on today's theme, which is titled Preparing the Canvas Together. We recognize that meaningful program implementation begins with relationship building, respect, and reciprocity. Just as a land acknowledgement invites us to honor Indigenous stewardship, histories, and ways of knowing, preparing culturally informed expressive arts programs are very skilled. It requires us to listen deeply, engage collaboratively, and create foundations rooted in things like community and trust and cultural humility. So I want to, so we know that preparation for, programs within the community or any community engagement happens many months prior to the start date. So this webinar really explores those key elements of successful community engagement, program implementation, including things like partnership development, cultural responsiveness, trauma-informed outreach, staff training, and participant screening. Practitioners, those that you see right here in our webinar session, will share practical insights and lessons learned and effective strategies, and maybe you also have those yourself. And again, I am not doing this alone. I have others with me today, so I'm pleased to introduce today's panelists. So the first I will introduce is Narges. Narges is a registered psychotherapist in Ontario and a trauma and wellness counselor at the Barbra Schlifer Clinic. She has been working in the field of counseling and psychotherapy for more than 9 years, and at the Barbra Schlifer Clinic for 2 years. She has an interest in and experience with applying arts and creative expression in her work. So thank you, Narges, for being with us today. Our next panelist, thank you. Our next panelist is in the blue background, Shruti. Shruti Anatomis is an MPH Masters of Public Health student at the School of Epidemiology and Public Health at the University of Ottawa, with experience in community-based participatory research in India and Toronto. And she was also one of our HEAL Research Fellows from 2024 to 2025, and she supported the implementation of evaluation tools, data analysis, and the training of many peer researchers and volunteers. Which leads me to our next panelist, Farhama Harris. Farhama is currently the Community Settlement Service Worker at the Neighborhood Group in Toronto. She has extensive experience working with newcomers, especially with women. She supported our HEAL program with the Farsi-speaking group and has honestly immense skills in building trusting relationships, guiding community members, and to me, a very exceptional leader in the community. And so I'm very grateful for Fahama to be here with us. And so, my last and final thing before we jump into the questions is sharing about the structure of our discussion. I will invite our panelists to respond to 3 guiding questions. Each panelist will have an opportunity to share their perspectives and experiences. And throughout the webinar, those who are attending, please interact with us or by submitting your questions, reflections, or comments in the Zoom Q&A feature. We will reserve time at the end of the session to address and discuss some of your questions from the panel. So thank you in advance for that. So without further ado, let's begin with our first question. What is important when preparing organizations and facilitation teams to implement art-based group therapy programs? And some of us may speak specifically to newcomer communities who have experienced violence. So I'm going to invite Shruti to start us off the conversation.
Thank you so much, Christen, for the question, and thank you so much for this opportunity to be here. So, based on my experience of being part of the HEAL project, what I can say relating to preparation is that the first aspect when it comes to preparing organizations, what I've noticed is that preparation really begins very, very early, long before the program actually launches. So this is at the very start of your partnership. So it means building a transparent relationship from the outset, establishing a shared understanding of what the program is, what it aims to achieve, and then discussing on what is the range of outcomes that are realistic for this particular population that you're working with, because often the organization that you're partnering with might know more about the population and the needs of that particular population much better than others involved in the discussion, maybe. And it also means being detailed with the partner organization about the capacity that is actually required, both at the organizational level in terms of sometimes wraparound supports being needed by the participants, and also the capacity required with the facilitation team in terms of skills, in terms of time commitments, so as to deliver the program safely and effectively. Now, it comes to preparation of the facilitation team. I would say I was more involved with the training of the peer researchers. So that's what I would be able to speak more to. Before I get into that, in terms of the HEAL facilitation team structure, we had each cohort being led by an expert facilitator, that is an art therapist or a mental health counselor. And then we had alongside them the co-facilitator, which is either a peer researcher who is a staff member from the partnering organization. So when it comes to peer researchers, they have been really the heart of the HEAL project. Their responsibilities were many, spanning from outreach to recruitment to throughout the HEAL project. But what I would want to stress on is that, how do I say that? They're very central to the program's success from what I have observed. And they're already located in this close proximity with many of the study participants, maybe due to similar cultural backgrounds or other shared experiences. And because of all of this, the peer researcher training that we had for those who are part of the HEAL program, it started actually months before the program actually started. And it was focused on building skills or basically initial knowledge around the research, as well as the ability to support vulnerable population. And the preparation was not just, even though it had logistical components surrounding communication and management, it was, I would say, a form of capacity building, kind of planned for the longer term for the partnering agency, as well as for the peer researchers so that they can carry this knowledge forward of how art-related therapy programs are implemented and how the community-based research surrounding it can be implemented and can maybe translated to different programs or different areas of work that they're involved in with the organization. So yeah, that's what I would like to say regarding preparation of the organization and the specifically facilitation team peer researcher component.
Yes, thank you. Thank you, Shruti. And I appreciate you talking about the timeline because that's definitely something that we have to implement, as we're thinking about strategy, having months and months in advance for training and building capacity. And you touched on a really good point. It's not only capacity of staff members, but as agencies, right? Which I'm going to pass it to Farhama because Farhama was one of our peer researchers that has gone through training. So Farhama, I'll invite you to respond to the question.
Thank you, Christine, for having me here. Uh, I think the most important thing, building trust is one necessary key points. Many like has many newcomers, especially like from some community, they are not comfortable to share or talk about their traumas, family violences, or mental health. Like it's something those topics are really private, or sometimes like I consider as a trauma or taboo in the culture. uh, Before the program start, we focus on creating a safe and welcoming environment, or culturally sensitive environment, I can say, where participants felt respected and knew the privacy would be protected, like by the agencies or the program. And what we saw that once women started attending the program, they became much more than healing program. Through the art activities, and they could express themselves without feeling pressure to talk. And they also built friendship, support each other, felt less isolated. For many women, they became place where they felt they felt belonging in the community. And that was one of the most meaningful outcome in my point of view.
Yes, yes, yes. Thank you, Farhama. And I think to your point, yeah, the success of, people enrolled into the Heal Expressive Arts program started even many years before. That trust building that you're saying is that they have to feel safe within an agency even before thinking about joining a program like this. So thank you for that. And I'm going to now pass it to Nargis.
Thank you, Christine. Thank you very much for having me. Good afternoon, everyone. I would like to briefly mention the difference between group therapy and the groups that we usually facilitate at the Barbra Schlifer Clinic. At least the groups that I have facilitated or co-facilitated are not called group therapy, but we call them group sessions or group programs. One of the reasons is that we ask the clients to be mindful and not share the details of their traumatic experiences in the group setting because other participants may not be ready and they might feel triggered or overwhelmed. So it's not group therapy, but it's group sessions, and they're still highly valuable. And the participants are welcome to to share their thoughts, emotions, and experience related to the activities that we have in the group sessions and to their here and now experience. So they can still name their emotions, even mention that they are survivors of trauma without going into the details, talk about coping skills that they have found helpful, how the art activity is related to their emotions, feelings, and thoughts. Another difference is that art therapy is better to be guided or facilitated by a registered art therapist, but other therapists like me, for example, registered psychotherapists, social workers, and counselors usually apply art and creative expression which is again very beneficial. We just don't call it art therapy because of the registration that is a little bit different. Again, it's highly valuable, it's beneficial for the clients, so it's inspired by similar practices and activities. In terms of preparation, if it's about preparing group programs for newcomers, consideration regarding respecting diversity and inclusivity is very important, as well as addressing and considering any language barriers, asking the participants in advance if any of them may need interpretation, including visual aid as much as possible, and using accessible language, as well as nonverbal communication and modalities that are accessible for all or the majority of the clients, such as visual arts or other arts and creative activities. It's also important to plan ahead and create a safe space for all participants to feel comfortable and welcome, considering their differences and individual differences, and applying a trauma-informed, anti-oppressive, anti-racism, and client-centered approach as much as possible. And to remember that these participants and clients may be survivors of trauma before immigration or after immigration. And Barbra Schlifer doesn't focus on newcomers, but we have clients and participants who are newcomers. And also, clients and participants who are trauma survivors may be experiencing a lot of stress related to navigating multiple challenges and limitations. So it's important to have that trauma-informed and client-centered approach. Also, when preparing for these groups, we usually prepare the agreement that will be reviewed at the beginning of the first session after land acknowledgement. And one of the points is about privacy and confidentiality. We reassure the participants how we respect their privacy and confidentiality. We also remind them to respect each other's privacy and confidentiality, and we explain how. Thank you.
Thank you. Thank you, Narges. And thank you for bringing up many different types of components here, things such as language. So sometimes not even translating or interpreting is enough. We need to be asking participants to make things not, mitigate jargon so that it's accessible language, even in their own language. Another point that I really appreciated that you said was the difference between different types of facilitators, right? Those art therapists or expressive arts therapists who are licensed versus mental health counselors or trained social workers who use art-based practice. And I think both have very different effects on communities, and you work with them very differently. And then lastly, to your points about the different frameworks, anti-oppression, trauma-informed, cultural humility, I think all of those frameworks are definitely things that need to be integrated and built and woven into program development so that everyone is understanding what those look like in practice and not just in theory. Which brings me to the next question about, specific training components. We know that in many organizations we do trainings, but I always, think to myself, how effective is it, So my next question is, what specific training components are essential for facilitators before program launch, especially those working with newcomers, gender-based violence, or those who have experienced trauma? So I'm going to actually start off with Narges first for this question. So go ahead.
Thank you. So ideally, if someone is trained in art therapy or creative expression therapy, that would be wonderful. However, as I mentioned earlier, other psychotherapists, social workers, and counselors are also able to apply creative expression modalities in their work if they're interested and if the clients are interested. So in that case, any relevant training that is reliable and approved in the province of Ontario or in Canada, that would be great. I took some relevant training by Mental Health Academy, which is joined by Canadian Counseling and Psychotherapy Association. I also learned a lot from my clinical supervisors who were art therapists. I learned some practices in my internship, and then after that in my work, because I was very interested, I read books, articles, and used online resources to learn and to train myself. And I always consulted with my clinical supervisors and colleagues. I observed art expression and art immersion groups that were facilitated by colleagues at this clinic when I joined the Barbra Schlifer clinic before I facilitated my art expression groups. And yes, so research, relevant trainings, and observation are all very important and helpful. Thank you.
Thank you. Thank you. And I'll pass this on to Shruti to talk a little bit about trainings.
I think some of the points that I wanted to highlight has already been highlighted in some of the responses from Narges, and especially the cultural safety part that Farhama answered to in the previous question also. So when it comes to training, before I go into those aspects, I would say the first thing is that shared understanding of gender-based domestic violence in this particular population of newcomers. So in newcomer communities, there is intersection with migration, with social isolation, with navigating an unfamiliar system in a new country. All of this kind of compounds on top of issues surrounding gender-based domestic violence. And it is important that everybody who is part of the team has an understanding of these intersections, because otherwise you would misread participant responses or mishandle disclosures. When I say disclosures, what I mean is maybe disclosures relating to immigration statuses, or maybe relating to legal conflicts or disputes or legal procedures that are ongoing, those kind of sensitive information. So starting with that shared understanding. And then when it comes to specific research-related trainings or research-related training components, I would say the very first one would be the basic TCPS2 core certification, which is the Tri-Council policy statement. So this is this particular training covers consent, privacy, confidentiality, and other aspects specific to evaluation research surrounding this kind of work. And then from what I remember, a particular training that I also completed was the Bridges to Safety training, which is a online course that is available for settlement and anti-violence sector-related staff. And this particular training was very important in building that common understanding regarding gender-based domestic violence in this particular population, that is newcomers, immigrant, and refugee populations. And I think other than that, there was other CAMH immigrant and refugee mental health related training that was recommended. And also there is a CIHR Institute of Gender and Health sex and gender training modules, which was also recommended for those who were part of the HEAL program. So these were some of the trainings that I can specifically point to. And then I would also say when it comes to training in art-based programs that has this evaluation research component, you need trainings specific to that evaluation component, wherein you talk about the surveys or the interview guides or the different evaluation tools that you would be using. So that is another kind of specific training that is needed. So a lot of those trainings have to be centered around really going through the questions that is being posed so that you understand the objective behind the questions so that that is helpful for the peer researchers or the people involved in the program delivery to support the participants in understanding the questions or in paraphrasing the questions in their own comfortable language so that they're better able to respond to such kind of evaluation research related questions. And also, I would say the most important outcome from all these pre-programmed training that we take together as a team would be to come to that same shared understanding and ethical commitments and facilitation approach that is a trauma-informed approach. Because when you have that coherence within the team, the people who are participating in the program, they feel that coherence, and that feeling brings a feeling of safety, and safety is very essential. It is a prerequisite for any expressive or therapeutic kind of program activity to safely and effectively take place. So these are some of the training components that I'd like to highlight. Thank you.
Wow. Thank you. Thank you for all those concrete ones. And for the Bridges to Safety training, I have done it myself and it's wonderful. So shout out to our friends at the Gender-Based Violence Settlement Strategy Project. You can look them up and we'll put it also in the follow-up email for you as well. And before I hand it off to Farhama, I just want to say thank you, Shruti, for talking about coherence in facilitation teams. That is so foundational that we understand as colleagues where we are coming from, how are we responding? And I think, it's so easy to just do trainings, online trainings, and tick it off as a box. But I think implementing the knowledge and having those crucial conversations of what we learned in the trainings, I think, too, was very fruitful in a lot of ways. And to the point, trainings take hours. And so that's why you got to start them months and months in advance. Okay, so now I'm gonna pass it now on to Farhama.
Thank you so much, Christine. From my experience, facilitators need training in maybe trauma informed care, culture awareness, and gender-based violence. Like that's the important one, like in my thought. And it's also important, like to know how to listen without judgment, respect confidentiality, and understand the challenges of newcomers, women may be facing. Working with the community partner is also helpful because we already have trusted relationship with many clients. That trust makes big difference when introducing sensitive problems or programs like this. Like it will be helpful for the between community and the clients.
Yes, thank you. Thank you, Farhama. I'm going to pause here before we go to the third question, just to address a question from the Q&A from Jasmine, so thank you. And the question is, are there any free or affordable training courses or educational resources for those who want to break into the expressive arts facilitation? I'm going to take a pause. If anyone wants to jump in, please do, and then I can respond to that. But yeah, maybe Narges, because I know that you kind of mentioned some expressive arts or arts courses that you've done.
Yes, Mental Health Academy joined with Canadian Counseling and Psychotherapy Association have affordable training. PESI as well, PESI, PESI Canada. And there was another one that I found today before our meeting. I'm gonna find it and
Okay, thank you. I think, yeah, and we'll put that in the follow-up email. So thanks, Jasmine, for that. Another, if you're based in Toronto, the Create Institute, which is the expressive arts, one of the expressive arts schools, has training courses. They are for cost, but if you are working for an agency, what I often tell people is to use your professional development money for these interests in expressive arts facilitation. So that can be an avenue, but we'll definitely put together a list of some of those for you. All right, thank you. And please, others, use the Q&A chat, the Q&A chat to send in any other comments and questions. All right, so I'm going to gear us to our third question here, which some of us mentioned, which is the preparation of participants. So not only organizations and facilitation teams need to be ready, but also participants need to be ready for programs. Something that we've observed is that not all participants or community members are ready to join a group therapy program, or even a group program in itself. So the final question, third question, is how do you evaluate participant readiness for an expressive arts program, and what kind of criteria or screening tools have you used? So I'm going to pass this to Shruti to start us off with this one.
Thank you, Christen. I think specific to the HEAL program, we had a dedicated intake screening tool, which was meant to assess readiness at that point of entry into the program. So this screening tool kind of had information surrounding participant characteristics regarding whether they need like acute or active support related to gender-based domestic violence, or whether they had any post-traumatic stress symptoms. That was assessed using a standardized questionnaire that was adapted. And also, as you mentioned, Christen, the readiness to participate in a group program, because for some people, for some interested participants, the interest would be to join a more one-on-one, more intensive program rather than a group program. So this intake screening tool that we have created was one way of how we went about it. And also, I want to be clear that the purpose of the screening or that intake screening to assess readiness is never with the intention of excluding people. It was just to ensure that we are able to appropriately support the people who join the HEAL program appropriately in the group setting that was curated for the program. So for individuals who appear to need more immediate or acute care, we connected them with the relevant resources whenever possible, and we also tried to facilitate direct referral to the support that they needed, be it housing or medical care or whatever it is that surfaced that seemed to be very acute and pressing for them to receive that immediate connection. So that was one. But also, I'd like to say that this readiness assessment is not like a one-time process. So every time people come into the sessions, we do have check-in activities, and the facilitation team is trained to adapt in real time throughout the program, like to check in on the participant needs and to address those needs and immediate concerns that they come into the sessions with before we move into any aspect of program delivery or evaluation, research delivery, or any of that. So that readiness assessment, yes, there is a tool that is delivered at the initial point, but it is a more constant process and a flexible process that, adapts and evolves according to the situation. And also, the readiness tool actually asks very sensitive questions, very personal questions. And here too, we have found that more than the tool, the delivery mechanism of the tool, as in who is the person who is actually having this conversation, whether this person has some pre-existing connections either with that particular person or with that particular population group, was very important in terms of assessing this readiness, because it's not just a checklist of questions you ask and answer. It is more of a conversation, that to a very personal, sensitive conversation. I think reflecting on the group that I was most involved with, which was the 2S LGBTQ plus cohort, here again, there was intersection of gender identity and immigration status and experiences of domestic violence, and all of this required a very careful and um, not just culturally appropriate, it needs a very sensitive way of engagement from that very first contact, which was the readiness assessment. So I would say, for your question, how do you evaluate participant readiness? It would be ideal if you have the tools, but also keep in mind that it is a continuous process. And most importantly, more than the tool or the document that you create, it is the delivery mechanism. Who is the person, or what is the channel through which that you're assessing this readiness? That is also of very huge, crucial importance. Thank you.
Yes, thank you for highlighting that communication, the trust building was so crucial. And it reminds me of consent. That consent is done oftentimes at the beginning of programs, but for programs like this, having consent throughout the whole process was actually very valuable, and doing check-ins and readiness is very valuable as well. And it goes to show how facilitation teams and facilitators need to be so skilled at being able to ask very sensitive questions while still responding in a very human way, which I think Farhama did honestly amazing with when we had to implement the readiness. So I'm going to pass it to Farhama to respond to this question.
Thank you, Christine. Myself, for the HEAL program, I met with the participants individually to better understand their needs, expectations, and their comfort level, I can say, without joining a group. During those conversations, I explained the program goals to them and the confidentiality we kept, and what participants could expect from throughout the sessions. I also emphasized that participation was voluntary, and there was no expectation for share their personal experiences and personal stories. Participants could engage through art, observation, and or discussion, depend on what felt comfortable for them. And these conversations help us determine whether participation was ready for a group-based healing program, or whether additional one-on-one support would be more better option for before participation or before participating to the program. And another thing, if I want to add, one of the biggest success, on this program, was seeing women build we can build trust connect with one another one. And many newcomer women, they came to Canada feeling isolated without a support system. And through this program, they felt connected.
Yes. Thank you, Farhama. Yeah, and I also want to note too that sometimes even if a person, is not ready in that year, maybe they might be ready later on, right? So it's kind of like a journey timeline that people go through. And we've had participants who've gone through the program, the group, and then built up enough confidence to seek out one-on-one mental health. So sometimes it can also go that way as well. They start in the group, they go to one-on-one, or vice versa. Yeah, so that was very handy to note. And thank you also, just going back to Shruti's comment, that it's not exclusionary, it's finding ways to support them best in the moments that they are in. And so I'm going to pass it to Narges to respond.
Thank you. Similar to what colleagues mentioned, we assess the participants' interest, needs, and readiness. Usually, for most of the groups here, we have pre-assessment. And for pre-assessment, we call each participant or potential participant who's interested, who was initially registered by the intake team, for a 20-minute brief phone conversation, and we let them know about the group, the purpose of the group, but we also let them know that we need to ask some questions to assess their needs to make sure that the group is a good fit for them. However, if they don't feel comfortable answering some of the questions, it's okay to say, I would like to, for example, go to the next question. But so far, they always answered the questions. The questions are about their needs, their previous experience with any similar groups or groups that may be supportive in the field of mental health, trauma-informed care, even if it's a different topic. Any previous experience regarding receiving support from counselors, social workers, psychologists, psychotherapists. Now, the next question about diagnosis may come across as intrusive, so I always remind them that it's okay if they don't want to answer, but it's better to know if someone needs a more advanced level of care from the beginning so that we can direct them to more relevant services, because even though they might think they're interested, a group setting may not be appropriate for them at that time. We asked them about any previous challenges or experience regarding how other groups or other services didn't work for them or what worked for them, what was helpful. And also another question is about their hopes, needs, and motivation regarding how this group can be helpful for them. We may ask them about their interests, as well as if they're able to attend all the sessions or the majority of the sessions. If they are not well one day or if they have an emergency, we will understand, but we ask them to let us know, because usually these groups at this clinic are more beneficial if the client is able to attend all the sessions or the majority of the sessions, because the consistency is important. We asked them if they feel triggered or overwhelmed during the session, how they would like to be supported. Do they need to take a break for 10 minutes? Do they need to debrief right away or after the group? We asked them if they have any food allergies or allergies to art supplies. We asked them if they need any accommodation, if they have accessibility needs. We also asked them if they need other forms of support, such as individual counseling sessions, and we let them know about the services that are available. Thank you.
Thank you, Narges. Thank you for giving all of those example questions. And as we can hear, it's quite a lengthy list of assessing someone's readiness or even needs. And I think that's why it's so important that, these questionnaires are also done over time, because sometimes folks from the community may not even know the answer to some of these questions. And so returning and checking in with them is very useful and helpful when looking at that. One that I would add to related to accommodation resources is childminding. I know that if you're able to put budget for childminding, it is so helpful for those parents and caregivers who have children that want to attend, and they have children. So that was something helpful that we saw, as well as transportation supports too. And from that list that Narges shared, you can also see it's very intimate, some of those questions. And so having someone who the participant feels comfortable with, you'll get, obviously different types of answers from whoever asks. So I think being very skilled at knowing who asked those questions can be helpful. All right, so we have a little bit more time here, and I see there's another question, and this question relates to outreach strategies. I know this is something that we found very challenging, but also found success strategies. So the question is, how do you engage participants for a gender-based violence program? Because there was a lot of stigma and judgment around maybe using that language. So I invite all the panelists here to share about what may be some of the challenges or successes when doing outreach for a gender-based violence program or mental health program. Yeah, and you can go ahead and unmute and jump in.
I think I can start by saying that for the HEAL program, what I have noticed is that when it comes to outreach, one, we tailor the outreach strategy for that particular population based on the knowledge from the partnering agency regarding what are the outreach strategies that have worked best for them in different programs. And also, when it comes to specifically gender based domestic violence, for HEAL program, we focused more on the art and the healing aspect of the program, and in ensuring that that is conveyed alongside the fact that the program is for gender based domestic violence survivors. So that change in focus or highlighting in terms of outreach, and also tailoring by really listening to the partnering agency and accepting their strategies of reaching out was something that I have seen personally as being very helpful, particularly for the HEAL program.
Yeah, thanks, Shruti. And I saw Narges, you were muted there. Yeah, go ahead.
Yes, at the Barbra Schlifer Clinic, actually, our marketing team does that work, which is wonderful. And then potential participants, individuals who are interested, call the intake team, and the intake team does the initial registration, and then we do the pre-assessment and the rest of it. However, a few years ago, at another nonprofit organization, in a wonderful program that supported newcomer women, we did outreach. I did outreach personally and sometimes with colleagues, and it was not easy. So usually I had a brief introduction to let individuals know that we understand that there is a stigma in some cultural backgrounds, and it's not about having severe psychiatric or psychological disorders. It's mostly about well-being, and anyone can benefit from, receiving this form of support if they're interested and if it's a good fit for them based on their needs. We explained how the sessions are. We did outreach for individual counseling as well as workshops and groups almost at the same time. But when it came to groups, I explained that the groups were there were different topics. Some of them were art-based, but we reminded them that speaking in those groups was optional, and that if they wanted to listen, they could listen. If they were interested in speaking and participating, they were more than welcome to participate. And I briefly mentioned about the activities and the benefits of the groups. For example, I said these services and the group sessions can help you manage and reduce your stress, because immigration comes with a lot of stress and you're navigating multiple challenges. You're actually resilient, and we acknowledge your resilience. But these services can be also beneficial for your well-being, your mental and emotional well-being, and overall well-being. So that helped.
Yeah, thank you. And Farhama, did you want to add anything?
Yes, thank you, everyone. In my talk, the outreach was the something it is the biggest challenge for us, but maybe like it's due to a stigma or the culture problems, or like discuss culturally discussing the traumas, it will be really difficult. And for many participants, we known them in our different programs, and at the same time we try our best to trust, gain their trust, and we had a um, one-on-one meetings with them, and we at the same time we try to make a safe and respectful environment for them. I just heard from like most of the participants, like they love the program because like the program was it's something open for them. They can it's safe. It became a safe spot for them. Like whenever they want to share something, like they are able to share, and it's not something by force. And like, oh, yeah, this is the outreach in income for us.
Yes, thank you. And you were so right. Out of all the 6 HEAL groups, outreach was very difficult and challenging. I'll just be very transparent about that. And maybe some of you on this call have experienced outreach as a very difficult thing when doing programming. Something I will also add is the power of participants, word of mouth. Many participants came to our program because of word of mouth. And so like many of us are saying, education is very helpful because often our imagination can create things that are more stressful when actually in reality it is so different. And from our feedback, I will say that many participants were very surprised and unexpected of what the program was actually about. So I think it's, yeah, taking time to do that education with participants prior and then letting them tell others in their community about it. The other thing that I noticed many of us talked about was language, right? Using a strength-based approach, focusing on the healing, the arts, the benefits of what someone can really receive from the programs that we implement was very helpful. And especially using words of gender-based violence or mental health, some folks don't want to disclose or even want to identify themselves as a victim of violence. And so, switching that narrative, even within our outreach materials, makes a huge difference on how people perceive themselves. And then lastly, Narges, thank you for speaking about partnering with your communications team. That is so important that program implementers or coordinators, we don't have to do this ourselves, that we have hopefully in your agencies a communications team that you can consult with and work with them. And I'll add one more thing before I just end off here is pop-up workshops. Art is not may not be familiar to a lot of people, we found. And so because people did not need experience with arts coming into the program, sometimes doing one-off quick pop-up workshops will get people to experience what it feels like to engage with the arts. And I think it's through experience that the buy-in really increases. And we saw that, in the first session, people were hesitant, but after one session of arts, they came to almost every single program after. So personally, I think that is the power of the arts. It is very low threatening, high impact work that we can all draw on. Yes. So before we end, I want to ask a last question, which is, what is one sentence or one learning from partnership development in each of your roles? So you can give it a couple seconds, 1 to 2 sentences of, your biggest learning around partnerships. Yep. And Shruti, you can begin and then we'll just go around the circle.
Thank you. I'm just thinking because I think there has been a lot of lessons because we had 6 partnering agencies and the HEAL program being reiterated. I think the biggest learning is in terms of communication, like when you're building partnerships, the communication aspect, the transparency aspect, and the expectation aspects. Expectations, as in what we would be, what we are. I guess it again ties to the first question that I answered in this webinar, like being clear about the expectations in terms of capacity that is needed and maintaining a very clear and transparent line of communication is what I have noticed as very important in terms of partnership building, be it at the organizational level or even be it at the team level, like bringing together 2 different teams from 2 different agencies to work together in partnership, that communication, transparency, while also being transparent about the capacity and expectations and everything. And yeah, I think I'll pause for now. Yes.
Okay, thank you. Thank you. And I'll pass it to Nargis.
it's very important to communicate and support similar programs and community agencies, because especially if we support the same or similar population and offer similar services, we can all support each other and support the clients in slightly different ways. So our services can be complementary and it can complement each other. A client may receive individual counseling at one community agency and be able to attend groups at another community agency if their schedule matches the other community agency better. Or if there's not availability at one community agency at that time, it's good if they can refer the client to another community agency with similar services.
Okay.
Thank you.
Thank you. And Farhana?
Thank you, Christine. Like in my point of view, as Narges mentioned, communication is the main focus thing, and as a partner agency, like we built trust with our clients, and we open to connect with the heal program, and at the same time, like it's like we just gave them a safe supportive spot, like, and the good communication is like for in my thought, like it is the key point between between agencies.
Okay. Thank you. Thank you. Thank you, everyone. And so, with the remaining minutes left, for those who are attending, as I wrap up with my ending sentences, please feel free to put comments. You can add more questions in the Q&A and we'll receive them on our end. And just to add on my end, I think one of my greatest learnings is having a posture of compassion that, yes, we are as a facilitation team supporting communities, but we are also sometimes part of these communities. And so supporting our facilitators was one of the biggest things, components that I think we need to do more of, and holding, yeah, like honesty in our ability to provide and serve others is also true for ourselves as well. So showing ourselves compassion and being honest with those challenges and working together as a team. So with that, we will invite you, to continue sharing in reflections in the Q&A. We would love to hear your thoughts and to continue the conversation. Webinars are sparks for greater dialogue with the people around you. I also want to add that we've released in partnership with the Healthy Debate platform, a 5-series article on arts, settlement, and healthcare, so check that out. An email will be sent to everyone here with follow-up items, including the final recording of the webinar and some of the resources and tools that we've mentioned. And I just want to say thank you for taking time out of your day to attend this webinar and helping us really imagine what healthier, more connected communities look like, all that preparation process that goes into it. And I'm sending everyone strength here if you're currently working on the preparation process. And next week will be our 3rd Creative Care webinar on Tuesday, June 30th from 12 to 1 o'clock. So please join us for that. And it's about HEAL Program Explained. So if you are curious about the HEAL program, please join us. We have our HEAL facilitators share about that. So you don't want to miss that. So thank you again and have yourself a very great day. Bye now.